Playing doctor with an online certificate. That's what passes for medical school these days. My Uncle Robert's voice boomed across the Thanksgiving table, red-faced from his third glass of whiskey, while 20 relatives laughed at his assessment of my career. I sat quietly cutting my turkey, letting him perform for his audience, knowing that in 72 hours he'd be lying on an operating table under my scalpel. Would he still be laughing then? It was supposed to be a nice family Thanksgiving at my parents' house in suburban Chicago. Turkey, stuffing, the usual family chaos. But Uncle Robert, my father's older brother, had turned it into his personal comedy show at my expense. I mean, seriously, Nina, he continued, gesturing with his fork. You expect us to believe you're a real surgeon? At your age? You're what, 28? 29, I corrected quietly. 29. He slapped the table. And allegedly a cardiovascular surgeon at Northwestern Memorial, the most prestigious hospital in Chicago. Do you know how ridiculous that sounds? My Aunt Linda, Robert's wife, nodded vigorously. It's one of those online degree mills, I'm sure. They advertise on late-night TV. Become a doctor in 6 weeks. She laughed at her own joke. My cousin Brandon, their son, smirked from across the table. Maybe she's a surgical assistant or something and tells people she's the actual surgeon. Like stolen valor, but for medicine. The table erupted in laughter again. My mother looked like she wanted to defend me, but didn't know how. My father was staring at his plate, his jaw tight. Uncle Robert, I said calmly. I attended Johns Hopkins for undergrad, graduated summa cum laude. Then Harvard Medical School. Then a 5-year residency in cardiovascular surgery at Massachusetts General Hospital, followed by a 2-year fellowship in minimally invasive cardiac surgery. I've been an attending surgeon at Northwestern for 18 months. Right, Robert said, waving dismissively. And I'm the Pope. Sweetheart, we all know you went to community college for a couple years then dropped out. Your dad told me. I looked at my father. He shook his head slightly. Robert, I never said that. Sure you did. You said Nina was studying something medical at the community college. I said she was taking anatomy prerequisites before applying to university programs, Dad said firmly. That was 12 years ago. She was 17. Same difference, Robert said. Point is, this whole surgeon story is clearly fabricated. Nina, honey, it's okay to be a medical assistant or a nurse. Those are respectable jobs. You don't need to lie about being a heart surgeon. I'm not lying, I said evenly. Then prove it, Brandon challenged. Show us your medical license. Show us proof you work at Northwestern. I don't carry my medical license to Thanksgiving dinner, I said. Convenient, Aunt Linda murmured. My phone buzzed in my pocket. I pulled it out. A text from my surgical coordinator. Dr. Martinez, confirming Monday morning schedule. Robert Stevenson, 7 a.m. or 3. Aortic valve replacement. Patient is stable but anxious. See you Monday. Robert Stevenson. My Uncle Robert. I read the text again, my heart rate picking up. I'd known I was doing a surgery Monday morning. I'd been on call for Thanksgiving weekend and had reviewed the preliminary case files on Wednesday. But I hadn't looked at patient names closely, just medical details. Aortic valve replacement, significant stenosis, urgent but not emergent. The patient was my uncle. What's that? Checking your Facebook? Robert asked mockingly. Or maybe playing one of those surgeon simulator games? I looked up at him. At his ruddy complexion, his labored breathing, his hand occasionally rubbing his chest. All symptoms consistent with aortic stenosis. Uncle Robert, I said carefully, have you been having any chest pain lately? Shortness of breath. His expression changed slightly. How did you? That's none of your business. You have a surgery scheduled for Monday morning at Northwestern Memorial, I said. It wasn't a question. The table went silent. How could you possibly know that? Linda demanded. Because I'm the surgeon, I said simply. Aortic valve replacement, 7 a.m., operating room 3. You're my first case of the day. Robert's face had gone from red to pale. You can't be. They told me I'd have the best cardiovascular surgeon in Chicago. You do, I said quietly. Dr. Nina Martinez, board certified in cardiovascular surgery, specializing in valve repairs and replacements. I've performed over 200 successful valve surgeries with a 98.7% success rate, which is why I'm the department's first choice for complex cases. This is insane, Brandon said. You're making this up. I pulled up my hospital ID on my phone, the official Northwestern Medicine app that only staff could access, and showed my credentials. Dr. Nina Martinez, MD, FACS, cardiovascular surgery, attending physician. That could be fake, Linda said weakly. Call the hospital, I offered, pulling up the main number. Ask for the cardiovascular surgery department. Ask who's performing Robert Stevenson's aortic valve replacement Monday morning. Nobody moved. My mother was staring at me. Nina, is this true? You're really his surgeon. Yes, Mom. I tried to tell you all at Christmas that I'd been promoted to attending. Everyone changed the subject to talk about Brandon's new car. My father was reading the medical app on my phone, his eyes wide. You've been a heart surgeon for 18 months, and we didn't know? I tried to tell you. Multiple times. But every time I mentioned my work, someone made a joke or assumed I was exaggerating. Eventually I stopped trying. Robert had gone very quiet. The surgery, he said hoarsely. It's serious, isn't it? They said there were risks. All surgeries have risks, I said, slipping back into my professional voice. But aortic valve replacement is something I do regularly. Your case is straightforward. Stenosis without significant complications. Standard procedure, good prognosis. But you're so young, Linda protested. How can we trust? I'm young, but I'm qualified, I interrupted. I can request that Dr. Peterson perform your surgery instead. He's 52, if age makes you more comfortable. His success rate is 96.3%, which is excellent. Or there's Dr. Kim, she's 45, success rate of 97.1%. Both are outstanding surgeons. What's your success rate again? Robert asked quietly. 98.7%. He stared at me. Higher than the older doctors? I trained under Dr. Catherine Walsh at Mass General. She pioneered several minimally invasive techniques that reduce surgical trauma and complication rates. I use her methods. The Catherine Walsh? My father asked, suddenly interested. The one who was on 60 Minutes. That's her. She was my mentor for 7 years. Robert was rubbing his chest again. If I let you do the surgery. Uncle Robert, this isn't about letting me. This is about your health. If you're uncomfortable with me as your surgeon, I'll recommend Dr. Peterson. He's excellent. Your outcome will still be good. But not as good. Statistically, my outcomes are slightly better. But the difference between 96.3% and 98.7% is small. Any of our department's surgeons would serve you well. The table was completely silent now. The mockery had evaporated, replaced by stunned realization. I thought you were a nurse, Aunt Linda admitted quietly. I told my friends my niece was a nurse at Northwestern. I bragged about it. I'm not a nurse. Nurses are wonderful and essential, but I'm a surgeon. Different training, different job. My mother had tears in her eyes. Nina, we're so proud of you. Why didn't you make us understand? I tried, Mom. Remember my residency graduation? I invited everyone. Nobody came because it was in Boston and Brandon had a baseball game that weekend. That was your residency graduation? My father said, horrified. We thought it was some kind of participation ceremony. A formality. It was the culmination of 5 years of 80-hour work weeks, learning to save lives, becoming a surgeon. But yes, also a formality. Robert's phone rang. He answered, his hands shaking. Yes, this is Robert Stevenson. Monday at 7 a.m. Yes, I understand. He listened for a long moment. Can I ask, who's my surgeon? Another pause. Dr. Nina Martinez. Can you tell me about her qualifications? He listened, his expression shifting from skepticism to shock. I see. Yes. No, I don't want to change surgeons. Dr. Martinez is fine. More than fine. Thank you. He hung up and looked at me. That was the pre-op coordinator. She said you're the best valve surgeon they have. She said patients request you specifically. She said there's a waiting list. There's usually a wait, I confirmed. Your case was marked urgent, so you were moved up. She said you published research in the New England Journal of Medicine. 2 articles. One on minimally invasive approaches, one on outcomes in younger patients. Jesus Christ, Robert whispered. You're the real deal. And I called you a fake. I laughed at you. He stopped, his face crumpling. Nina, I'm so sorry. Will you still do the surgery? After what I said. I looked at my uncle, arrogant, dismissive, cruel in his mockery. I thought about saying no, about recommending Dr. Peterson and walking away. But that wasn't who I was. I didn't become a surgeon to punish people. I became a surgeon to save lives. Yes, I said. I'll do the surgery. Because that's my job, and because despite everything, you're family. Thank you, he whispered. Monday morning. I arrived at Northwestern at 5:30 a.m. Robert was wheeled into pre-op at 6:50. Linda was holding his hand, her eyes red from crying. "Dr. Martinez," Robert said formally. "Thank you for doing this." "You're welcome, Uncle Robert. When you wake up, this will all be over and you'll have a brand new valve." "Nina," he said as the anesthesia started. "I'm proud of you. I should have said it before. The surgery took 4 hours. Standard valve replacement, no complications." When Robert woke up 6 hours later, I was there. "Hey," I said quietly. "How do you feel?" "Like I got hit by a truck. But alive. That's normal. Your new valve is functioning beautifully." His eyes filled with tears. "You saved my life. I did my job." "No," he said firmly. "You saved the life of a man who mocked you. You could have refused. But you didn't. That's being exceptional." 3 weeks later, Robert was recovering at home. He called me one evening. "Nina, I wanted you to know. I told everyone at work what happened. About how I didn't believe you. About how you were my surgeon anyway. About how wrong I was. You didn't have to do that." "Yes, I did. People need to know. People need to stop assuming young women can't be at the top of their fields. People need to listen when someone tells them who they are." "Thank you, Uncle Robert." "No," he said. "Thank you for saving my life and for teaching me something I should have learned decades ago." The next Thanksgiving, Robert stood up at dinner and made a toast. "To Dr. Nina Martinez," he said, raising his glass. "The best cardiovascular surgeon at Northwestern Memorial Hospital. My niece. I'm proud to be related to her, even though I didn't deserve her when she saved my life." "To Nina." "To Nina," the family echoed. I raised my glass and smiled. Finally, they saw me. Not as a fake, not as someone playing pretend, but as exactly what I'd been all along, a highly trained surgeon who'd earned every credential she claimed. And Uncle Robert? He became my biggest advocate, telling everyone who would listen about his niece, the heart surgeon. Sometimes people need to be proven wrong to learn they were wrong. And sometimes the best revenge is saving their life and letting them live with the knowledge of how wrong they were.